Hello, I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. In the series of the role plays, today's role play is for the nurses, and the setting is Community Health Center. Here, the patient has come to you to gather information regarding the need of malaria medication while he's on a trip. So, I'll explain the task and we'll start with this task. But before that, an important information, if you have not subscribed my channel yet, subscribe it right now so that you should be able to get the latest information on the updates on my channel. Whensoever I'm uploading any new video, you should get the information regarding that. And along with that, if you like my videos, do not forget to like and share it with your friends. Now, let's start the topic. So in this topic, 36 years old patient is going on a trip and he needs to take the malaria medication. But as if this patient has a history of depression and he has read it somewhere that malaria medication has a contraindication with depression medicine. So he wants to inquire about that. Now the topic will be started by your welcoming note or wishing the patient. You may start the task to yes, important information, nurses or doctors. It is your duty to start the task. Do not accept the interlocutor to start the task. As in the case of us, usually we find that interlocutors are taking or they are playing the active role because they are the examiners. Where here it is interlocutor and he will be or he she or will be playing the passive role. You have to be active here. Now, you have to start the task by saying, good morning or hello, my name is Maria or anything, whatever the name of yours. And I am a community health center nurse or I'm a registered nurse working in this community health center. How may I help you? Then you should say that the nurse have come to get information regarding the need of malaria medicine as I'm planning to go on a trip and this trip is for 4 weeks and the doctor has asked me, my GP has asked me to see you today regarding this. Then you should pursue further by, yes. But before I could start my conversation, I would like to know that how would like to be addressed or how may I call you? Then the patient may say that my name is mm, Sam or Bob, because I've used Sam in many of the videos. Let it be Bob. My name is Bob. Then you should pursue further by asking, fine, Bob, how many days trip is it? Or for how many days are you going for a trip? Will say that it's for 4 weeks. Okay, fine, that's good. You're going for 4 weeks. Where are you going? Then he may say that is a topical area. Actually, there's a camping trip of ours and we are 10 people who are going there. Then you should ask that, do you feel that there would be mosquitoes around? Then you should say that definitely when it is camping site, there would be mosquitoes all around. Then the next question would be that, Bob, as you told me that you're taking depression medicine, for how long have you been taking? Then the patient may say that it is for the last 1 year or few months. And it may be that he took this medicine in the past and he's not taking this medicine now. But he feels that once he has taken this medicine, it may have some uh, reactions or with the malaria medication. Then he should pursue further by saying that it is rural, urban area. We have already gone with this. Yes, now it's your turn all for this. Yes, Bob. First of all, it's mandatory for you to take malaria medication with you as your doctor has advised, as per your doctor's advice or as your doctor has prescribed you. And your doses will be 1 tablet. This is 100 mg daily with the food 2 days before the trip, during the trip, and 4 weeks after you return from your trip. Then the patient may say that this means it will be quite long duration of the medicine. And as every medicine has some side effects, definitely this medicine will be having some side effects. then you should say, Bob, I can understand how you're feeling about this, but first of all, your protection is much more important than the side effects, which could be minor. As you are going for a trip and you are expecting mosquito bites there. So it is important for you to protect yourself from malaria, because malaria is a fatal disease. And if you get infected by this, it may lead to some serious consequences afterwards. So avoid that. You need to take this medicine along with you, and you have to take it as prescribed by the doctor. And the next part could be, along with this medication, there should be the double protection. I mean to say that you should protect yourself by other measures also. First of all, there is a mosquito net. You can take this along with you and protect your bed by this net. Secondly, you can apply mosquito repellents, or by applying this on your body. There is a lotion, or there is some tube which you can apply on your body, which can protect you from mosquito bites, because it is mandatory for you to protect yourself as much as you can, as a high risk of this mosquito bite in setup of the areas. And as you're going to live for a long time, you will not be able to get immediate medical care where you're going. And it is always better that you should be prepared for the worst possibilities, and carry on all the preventive measures with you. Then give the reason for the long dose of doxycycline, that it is allow time for the multiplication of the parasites. So see, there is a rapid multiplication of the parasites in the body once it gets infected. So as we know, that is the female anaphylis, which is responsible for malaria. And as the malaria parasite, this malaria parasite, it is quite dangerous for the mankind. So to avoid that, you need to carry on this medicine as prescribed by the doctor. Find out the reason for the patient's reluctance to take medicine over a long period of time. As I've already discussed, that he's scared of some side effects. Now, you have to tell, Bob, yes, your concerns are right. There might be some side effects like heartburn, it may be stomach upset, or increased risk of sunburn. For that, we have other solutions. You should take the food which will relieve you from acidity. And secondly, if you find your stomach upset, you can take some light food. Do not take some heavy food. And above all, apply sunscreen on your body, and it will protect your skin also. One, the patient risks not taking the medicine if the malaria is contacted that the heart, kidney, or yes. This was a question to be asked first. Bob, can you please tell me if there is any medical concerns? I mean to say that whether if you're suffering from any heart or kidney disease. If the patient says, no, I'm not suffering from any such disease, then you should say that then it's right. You should carry on this medicine. But if you have any problem related to kidney or heart, in that case, it is contraindicated. It is not advised. Otherwise, your doctor has already examined you, and when he has prescribed this medicine, in this case, he is not feeling that it is contraindicated in your case. Then you should end up the task by saying, hope I've made myself clear to you. Bob, if you have any concern, you may ask me without any hesitation. You want to ask me something? So this way you can end up the task. And one thing important you can tell at the end, Bob, I'm giving you a pamphlet which has a complete information regarding do's and don'ts. What to do, what not to do while on your trip. And it will help you. And there is an emergency number written on that. If you find any assistance, if you find any problem there, if you find any type of the risk, you can contact us at the emergency number. We'll provide you the suitable assistance and advice there. And at the end, just wish him good journey or safe journey. So Bob, have a nice journey and see you in a good condition when you come back. So this way you can end up the task. Hope this video will be helpful for you and you can prepare your task with these notes and these tips, and this will be liked by you. And if you like my videos, do like it and share with your friends. And if you want me to make some special video for you on any role play or even the writing task or any listening or reading, do write down in the comment box. I'll definitely make those videos also for you. So wish you all the best for your exams and happy learning. Stay connected. See you with the new video very soon. Thanks for watching. Stay connected.